nowadays. So that's why I love actually sharing a lot of videos of elite athletes warming up, of elite athletes doing sort of the lighter days, because it allows the younger lifters to go, oh, wow, this is my favorite athlete and he back squats 900 pounds, yet here he is warming up with the barbell, and then 135 pounds, and then 225 pounds. And look how intensely he is focusing on his technique. So I think the big thing is that as a society, we have conceptually rearranged what's most important. We only think that it's the end result, and we completely discard the process of getting to that end result. And I think it just comes with education and in making it cool, basically, to focus on form first, knowing that it is a long process to get to where you want to get. It's not something that you're going to master overnight. You know, especially in today's society, it's not sexy to say, oh, you want to gain strength. You're going to have to go to the gym consistently 3 to 5 times a week, focus on a few exercises, try to perfect them, try to gain 5 pounds maybe every couple blocks, and then do that for 5, 10, 15 years. That doesn't sell a lot of people, but that's the truth. And the thing is, the faster we get that education out to younger athletes, to show that a lot of these amazing athletes who got there did so the right way, the process that they took to get there, then I think we're going to get a lot more people doing things the right way. You're going to have a lot less of these nagging injuries that pop up, because I do think a lot of injuries come from either a problem in load management and or technique. And a lot of times when you push too fast past the technique that you're capable of handling, it increases your risk of injury.
I know that, well, I've been lifting for about 3 years. And when I started working with a personal trainer around like 3.5 years ago. And right off the bat, I wanted to start with the barbell because I thought it would be like, cool or whatever. And he had me doing like RDLs with dumbbells that were really light and kettlebell work and all this stuff. And I'm like, when can I squat? When can I squat? And he was constantly like, we have to get your knees straight. We have to get your knees straight. So I appreciate your channel. You kind of like backed him up because I was looking on the internet for ways to prove him wrong. But it actually is, it's like really great, the stuff that you're putting out. And now I'm able to safely, progress. And I'm able to get a lot more out of my joints here.
Yeah, it's all about starting and then just slowly progressing. The squat motion is for every single person. The squat exercise is for every single person. It's just about getting started and progressing within your limits. Not every single person has the ability to jump to a barbell back squat at 225 pounds the first time they lift.
Yeah.
Sometimes we have to go a little bit slower, but that doesn't mean we don't squat. It just means we got to find what's right for us within our technique capacity so that we can get some exercise in and do so safely.
So I'm curious, what are some of the most common injuries that you see in your practice? And what are some ways that you would suggest to prevent them?
Yeah, I would say definitely when it comes to the most common injuries, I see a lot of knees, I see a lot of backs, and I see a lot of shoulders. And those are just the most common, especially back pain. Back pain is the most prevalent injury across the board in the United States. You talk to 80% of adults will have had back pain at some time in their life. And the biggest thing to do is just stay within our means when it comes to technique in training, and that making sure that we have sufficient technique before we start loading. We don't always have to be 100% perfect before I ever start pushing weights within the gym. We're always striving to have perfect technique. But the big thing is there's this, this gray area where it's a beginner who has poor technique. And then there's this middle ground where we have sufficient technique to start training and start adding some load. And that's where I think a big thing is having a coach, or nowadays it's really easy to find someone even online that can take a look at your lifts. Whereas, decades ago, if there wasn't a coach in your town, it'd be tough to find some advice. Nowadays, we have this amazing thing called the internet that, you can find online coaches that are qualified to take a look at your lifts and give you some helpful advice. The biggest thing is just staying within your means as far as technique goes, and slowly progressing. That's the biggest thing. I think that can help a lot of people with back pain.
So you wrote that all strength athletes deal with pain, but your book also says pain's not necessarily a medical issue. So I think you kind of touched on this a little bit right at the beginning.
Mhm.
Can you explain what you mean by that?
Yeah, the analogy that I was given was that if you had a light bulb go out in your house, would you call an electrician every single time to change it? I would hope most people would say no. I believe that most of the common aches and pains that we get from lifting and just everyday life are not dire medical issues that need to be taken care of by a medical practitioner. Now, there are times where if you tear your ACL or you've had, a back pain that has gone on for weeks and weeks and weeks, or you have something that is so debilitating you can't walk, yes, get in to see a practitioner. That's what they're there for. But if you have a small nagging elbow pain that hurts every time you press, or your back hurts every time you try to deadlift, but you can get throughout most of your day okay. These are things that you should have the power to take the first crack at fixing. And you just need the knowledge of how to approach it because there's so much information out there today. Some good, some crap. And the idea is that you just need a little bit of advice as far as how you can go about it in a systematic way to uncover your individual reasons for pain. So if you Google how to fix knee pain, and the first thing that pops up is do these exercises, you're at the wrong thing. Every single ache and pain in our body has to be evaluated to uncover the individual reasons that you developed that. Because if I line up 10 people, all who are complaining of back pain, they may have many different reasons for developing that back pain. There is no one size fits all approach to any type of injury. That's why, unfortunately, sometimes you'll leave the doctor with a back pain diagnosis of non-specific low back pain. That just means that you didn't have a doctor who was able to give you a specific diagnosis. There is ways to uncover your specific triggers for pain. We just have to understand how to evaluate it. And that's where this movement-based approach comes in. This is the way in which many physical therapists approach our practice, in that we try to screen the body and uncover specific limitations that we believe to be creating your pain in the first place or leading to the provocation of your pain. That may be a mobility limitation, a stability problem, a coordination issue. It all comes down to a proper evaluation that exposes your individual cause for symptoms, but also understands what things that you can tolerate. Because the big thing is, the last thing I want to tell people is stop doing this. I always want to say, all right, here's what we need to back off on right now, but here's some things that you can do to help slowly build capacity so that you can return to the things that you want to do. You should be able to squat for life. You should be able to deadlift for life. I had a patient the other day come in and they said, the doctor told me I should never squat again. And I said, well, how do you expect to get on and off your toilet? Basic, simple things like that. We don't even realize that's a squat. Oh, I can't deadlift. How do you want to pick your kid off the ground? You're hinging over and you're picking a load off the ground. The gym is a way that we improve our capacity for life. Yes, there's the athletic pursuit aspect to it because you can become bigger, faster, and stronger within the gym, but it's also a way that we build capacity for life. So a lot of the small aches and pains that we get in the gym, I don't believe are medical problems. They are life problems, small little bumps in the road that we should be able to have the power to navigate around.
So we have a comment in the chat from Ellen. She said, I had a car accident in my 30s and ended up having spinal neurosurgery at the L4, L5. The surgeon told me that the chances would be good I'd be back for L3. After rehab, I started Olympic style weightlifting, including snatch in my 30-inch and 40-inch, not 30s and 40s. Now in my 60s, I'm very skinny. How can I add muscle at my age?
So we can always sometimes get a little bit better at gaining some muscle. It sort of depends on where you're at in life, but there's almost always a little bit of progress we can make. The biggest thing is making sure that we find a professional that can help guide us, because there's a lot that goes into gaining muscle. It's not just sets and reps. There's a lot of nutrition and how you're scheming with your programming. So finding a professional that you can work with, a coach that can help give you the best advice for where you're at individually can be very, very helpful.
I know you just talked on your podcast to Joan, who's in her
Yeah.
70s, right? And
Yeah, Joan's crushing
she's got guns. I'm
She
jealous of
does
her.
have guns, yeah.
Let's see. If anyone has any other questions, feel free to drop them in the chat. If you want to send an anonymous question, you can do that in the Q&A at the bottom of the screen. And if you're on Facebook, you can just type a comment and it will come through to us. Did you have any questions, Megan?
Oh, I have so many questions. I've been watching, Rory's been amazing at recommending Squat University, and I've been watching the YouTube channel, and it's fantastic.
Thank you.
So thank you so much for throwing that out there. I can't wait to get my hands on the book. It's hard to come by around here, so that's pretty exciting. But yeah, my question, why squats? It seems like you kind of opened up with the idea that this is a basic human like movement and this is what we need to be doing, but are there others that you feel like we could be working on in general? I'm inspired. I just a little backstory. I have back pain, lower back pain. I can't pinpoint an accident that occurred. I'm sure there was one in my early 20s. So I would say that now, after a year of physical therapy, I'm doing fantastic, and I can't thank I can't thank my physical therapist enough. But there were so many basic things that I just wasn't doing, and my body became so sedentary. Mm-hmm. And I think that's part of it. But the squat as like a basic movement seems elementary. Are there others that you would recommend?
It seems elementary, but it's one of those things that once you master the capability to do that, it allows you to flourish in so many other areas. I would ask anyone listening right now, can you sit in the bottom of a deep body weight squat for 5 minutes? Just relax down there. And I'm talking completely down as deep as possible, like you could as when you were a child. And I would say most people are like, no, there's no way I could do that. That should not be a problem. If we go about things the right way within our physical capabilities throughout life and train our body, the right way, that should be something that you have for the rest of your life. Go over to a lot of countries where maybe sitting in chairs isn't as common. For example, my co-author in my books, Kevin Santana, his parents are from Laos. His mother routinely sits in a deep squat while like preparing dinner. That's something that I think, especially in American culture, that we're like, whoa, that's an exercise that I do on Mondays. The squat should be something that you do every single day. And when you have that capability, just to regain full depth motion in your squat, it allows so many other activities that you do in motions throughout the day to get a lot better.
I think a lot of the other librarians here think I'm a little strange because I'll do that like when there's nothing going on. I'll just be like in a squat way down low in the office, and they're like, "What are you doing?" Like just talking to someone in their cubicle.
Yep.
But it's comfortable. It should be comfortable.
Exactly.
So we have a Facebook question from Katie. Yeah. What are some good exercises for new moms with big old babies?
There are plenty of things that new moms can do with big old babies. I mean, as funny as it may sound, a baby is a great goblet squat.
It progresses with you.
It progresses with you. That is the fundamental progressive overload, if you want to think about it like that. Actually, I do remember in early quarantine last year, there was a number of people that were showing like getting fit with their kids at home. And a lot of moms were actually showing different exercise regimens and things that they could do, push-ups with their kid on their back and things like that. That was really cool to see.
So similar to this, I know that you're an advocate for encouraging kids to start lifting young.
Very much so.
So just kind of as a transition, so I think that question came from my sister because her name is also Katie. But yeah, she has a toddler who is surprisingly strong and very big for his age. And I'm always joking with her, but not really, that he's going to come start lifting with Aunt Rory someday. What is a good age for kids to start, and how could I convince my sister and other parents in general that that's actually safe and there are benefits?
So the first one is, when is it appropriate? Really, it's whenever they can follow rules and, actually listen to someone that's giving them instruction. The biggest risk for injury in the weight room for young children is really when they're horse playing around and not listening to instruction, and they drop a weight on their toes or something. So really, if they can listen to instruction and follow a coach's recommendations, I've seen athletes as young as 4 years old training. Now, obviously, the loads are very light. There's children's barbells that are, only a couple pounds, but there is not a shred of evidence that shows that lifting weights at a young age is dangerous. So actually, I wrote an entire blog called "When Can My Child Start Training?" and I did part one and part two. So you can look at that on for free on squatuniversity.com. But I believe it lists at least 12 different research articles, systematic reviews, and expert commentaries from researchers that looked at injury risk and also the ability to train for performance. So like powerlifters and weightlifters competitively as young as like 8 and 11 years old, and they are training with very low risk of injury. And it actually might surprise many people that the risk of competing in powerlifting and weightlifting at a young age is significantly less than playing basketball or football or soccer. So it's actually a much safer injury or sport. There is no risk at all for fracturing growth plates and stunting growth. That is a complete myth. And actually, lifting weights at a young age will even decrease an athlete's injury risk when they go and play other sports. So it is a very safe thing as long as a couple things are followed. You have proper instruction. So we want to make sure that we're getting linked up with a coach that understands how to teach proper progression, proper load management. We're not having an athlete try to max out on something that they can't yet tolerate well with good technique. So slow and progressive loading, just as we would do for an adult. So really the same things apply. Just a lot of adults don't follow that, and that's why I believe we get a lot of injuries. But the same protocols apply.
Awesome. So Alex from Facebook says garland pose is my go-to rest pose. Okay. So can we talk about foam rolling a little bit? I try to roll out before I warm up, and I'm like always curious if I'm doing it long enough or doing the right thing. What does effective foam rolling look like, and how long should it take?
So it's going to depend on every single person whether or not they even need to foam roll. So foam rolling is only a tool in our toolbox. And what science shows is that for some people, as little as a minute to 2 minutes of foam rolling on a particular muscle can help in the short term increase flexibility. So what it doesn't do is lead to long-term flexibility improvements. It doesn't lead to any increases in strength or anything like that. It's only a tool in our toolbox that can help in the short term improve flexibility. Now, when would someone need to use it? Let's say you're on your feet all day long, you haven't had a chance to really move well, sit down into a deep squat, and you get to the gym and your calves are just super tight. Well, maybe a minute of foam rolling on the calf may help improve that flexibility in the short term to then allow you to have better access to your range of motion and better mobility whenever you're lifting. Also, same person could just do a dynamic warm up. So it's not a 100% must for every single person. And then also sometimes it can be helpful in the injury rehab process as, again, another tool in the tool belt, depending on what an athlete, an individual needs to improve upon any weak links they may have in flexibility. So I'd say as far as how long do you do it, I would say max like 1 to 2 minutes per area that you're trying to improve on. And the biggest thing is get on the foam roller if you think you need it. Find any spots that are a little stiff, work them out a little bit, get off and get to your workout. The last thing you want to be doing if you are going to foam roll is be laying on the ground for like 10 minutes. That's a waste of time and you're not doing anything. You could be way more effective and efficient with your warm up, doing more of a dynamic warm up.
So aside from foam rolling and that kind of warm up, you're talking about like dynamic warm up, but what are also some strategies for like mobility exercises in between workouts that might help increase your mobility and increase the depth in your squat safely?
Yeah. So again, it's all going to depend on the individual, and that's where the proper screening process comes in to understand what are your individual limitations of what you need to work on. Because the last thing you want to do is just throw out, all right, here's the 5-minute squat sequence, and I have no idea what I need to work on. And maybe you're doing things that are helpful. Maybe you're doing things that are just sort of a waste of time because you already have excellent mobility there. Now, there are a number of different mobility drills that you can do, and I share a ton of them all across social media. The biggest limiting factors, if I was to speak generally, is going to be ankle mobility and then hip mobility, if we're talking about squat depth, and particularly ankle mobility. If anyone is interested in looking, just go on YouTube and type in top 3 ankle mobility exercises by Squat University. And in doing so, what you'll find is a simple screening process to uncover whether or not you have a deficit in that area. And then also a couple different drills that you can use to find out whether or not that helps. And then the big thing I'm always keen on telling people is test and retest, because what that does is at home gives you an appreciation for whether or not what you're doing is worth it. Because the last thing we want to do is just do an exercise because it looks cool on social media and then doesn't actually help us improve our movement. So that's really where the end goal is with every mobility drill we do, is to help improve our movement quality. So you mentioned the full depth squat. What I would have someone do is check their ankle mobility. If they came up short, what I would first do is have them try their squat, just a simple body weight squat, see what it feels like, maybe video themselves from the side so they can see their actual depth. Then go through the mobility drills, immediately retest their ankle mobility test that they did before. Did it improve? Yes or no? If it did, try the squat again and see whether or not that carried over to improved movement quality. That will let you know, hey, I'm onto something. This is where I need to go. And that will help you then move better throughout the day. And then that's how you get it to last. A lot of people love doing corrective exercises, and then they don't do anything to lock that new mobility in. That's why they have to stretch their calves every single day, because it helps in the short term, but it's not actually helping them create lasting changes. That's where, like you mentioned, sitting in a deep squat throughout the day, you're actually expressing your full mobility and you're teaching your body how to move through those ranges and actually make it something that is a part of your new movement vocabulary.
Are there any other resources or experts out there that you kind of look to that you would recommend outside of Squat University for people to check out?
Definitely. Yeah, there's a lot of really good people out there. I'll tell you just a few of my mentors who I learned from on a daily basis. First one, Kelly Starrett. He started Mobility WOD, which is now the Ready State. He was sort of the first physical therapist, strength and conditioning mix to start putting out a lot of free information on the world back when YouTube was still filmed on an actual camera, not on a cell phone like we do nowadays. He's a big one. Gray Cook, who wrote the book Movement. And also Dr. Stuart McGill, who has a number of different books, particularly The Back Mechanic, which is one of my favorites that I recommend to people.
Did you have anything, Megan? Any questions to ask?
Well, mostly I wanted to ask about Dr. Stuart McGill and your passion for him, but I'm writing down back mechanic right now. Thank you.
You're welcome. Yeah. So Stu is one of my mentors when it comes to physical therapy and the way I approach the body. There have been a number of different times throughout my career where I have had sort of that type of day where you learn something, and once you see it, you can't unsee it. It's that Matrix type experience, if anyone remembers those movies from the early 2000s or later 90s, I guess now. And it's the idea that how he approaches back pain was unlike anything I had ever seen. It was not something that I learned in school. It was not something that I learned my first couple of years when I was out of school and working as a full-time clinician, and I came across it. and it just blew my mind. It was like, this makes so much sense, primarily because I am a weightlifter before I was a physical therapist. So I understood the mechanics from a biomechanical viewpoint, exercise science viewpoint, and personal experience and pushing weight, and then molding that into how he appreciates how everything is a little bit different as far as how injury occurs. Could be movement, could be load, a combination. It was one of those things that once I saw it and started diving into it, I couldn't get enough. And I ended up diving into every one of his research articles and then seeing where he cited things and then reading those. And it just became a rabbit hole that I went down. It didn't come up for air for a couple years. And I've since been able to talk with him on my podcast numerous times, collaborate on social media content. And the reason I talk so highly about his approach is because I see it work day in and day out with my own patients. It's not something I just read about and believe it to work because I read that it has helped other people. I literally see it and I use his approach. Obviously, there's a little bit of my own blending that I have done with my own past experience that may be a little bit different, but for the overwhelming majority of things, I have seen it work for years with hundreds and hundreds of patients dealing with many types of back pain. And I've seen it help people get out of pain and get back to a high level of performance and just living life without pain.
So I just wanted to remind everyone, if you have a comment, if you're watching on Facebook, type a comment or a question. We'll share that with Aaron. And if you're here in Zoom, you can drop that in the Q&A or in the chat, and we'll get some answers for you. From Mel on Facebook, she says, not a question, just wanted to say I'm super happy to see this Zoom interview. I've been following you online for almost 2 years. I left my trainer and restarted my powerlifting journey by myself, working on proper form using lower weights. It was a long process, still working towards goals. I love the progress. Thank you for all of your information.
That's awesome. I love hearing those stories.
Let's see. We also have a question from Peak Training. How about for us that are hypermobile? How do you recommend creating a strong and safe bottom position that won't injure the joints? I have a hard time knowing where the bottom of the squat should be because I can squat like a toddler, but have a hard time building solid strength there.
So if you have a hard time knowing where your bottom position is, that's a great thing. You should squat as deep as possible. The idea then, if you're hypermobile, that's a great thing because then we don't need to work on mobility. We just have to work on stability and control. For example, I work primarily with a lot of Olympic weightlifters. I'm an Olympic weightlifter myself. When I squat now, I sit my butt on my heels. That's how deep I squat. And if you want to be a good Olympic weightlifter, you better be squatting that deep because that's how you actually catch a clean or a snatch if you're trying to do so efficiently. So the goal, therefore, then, is if you have that much mobility, it's then about control. And it's about learning how to stabilize. So in that instance, one of the first things I would learn is how to properly breathe and create stability with bracing, and then slow, controlled movements at first. And one of the most simple things is tempo lifts with pause squats, literally taking 5 to 10 seconds on the descent of light squats, feeling for being balanced, take off your shoes, get into barefoot stance so you can feel the ground underneath your body, going as low as possible and feeling for being a secure structure in the bottom position and pausing down there for a couple seconds before coming back up. And I've got a lot of content across social media on tempo squats and pausing and improving your stability down there. Again, also a lot of resources on my YouTube just on proper breathing and bracing. So not everyone has mobility issues. I see a lot of athletes who have a ton of mobility. It's then about stability and control. We just understand our focus is a little bit different.
Okay, so I have a colleague here who's not in today, but he wanted me to ask you a question. So he just started training and working with a personal trainer, and he, like me, has some past knee stuff. He's like, what is that, runner's knee or jumper's knee? And was wondering like what to do about his joints because stuff's starting to act up again.
So the first thing is understanding we have to do a proper screening. We have to understand why is it acting up. Again, achy knees, if you type into Google how to fix achy knees, you'll see a ton of content. Some of it might be good, some of it might be bad. So it's really tough to say exactly. We have to do a screening process. Now, I actually have a free YouTube video just called 4 Tips for Knee Pain that shows how to understand and screen what most people are dealing with when it comes to knee pain. And then from there, understanding that it's get proper movement first, alleviate those mobility and stability deficits, and then slow progression with loading and making sure that technique qualities are highest quality. And then also just making sure that throughout our day, we're moving well. We're understanding that we're not pushing through pain. So we're being conscious of what we're feeling is a big thing as well. A lot of people love to, when they're feeling a little bit of achiness in the knees, I'll just pop a couple ibuprofen and put my knee sleeves on. I'll be fine. That's going to end up in the long run not being a good thing.
So you had recommended a couple of times the toe separator things. Can we talk a little bit about I still don't understand. So I got some of those, like a different brand, and like it helps me with my squat form and stuff, but
that's awesome.
I have no idea how the science works. Can you kind of explain that and maybe talk a little bit about proper shoes? I'm used to squatting barefoot since COVID started in my apartment, but I'm heading back to the gym, and like the shoes are so uncomfortable, even the wide toe ones now, because I'm not used to working out in them anymore.
Yep. So I'll say to those listening to this part, a lot of the information that I'm getting is because of Dr. Ray McClanahan, who is the founder and creator of Correct Toes, which is the brand of toe separators that I use. So a lot of the information is stuff that I have learned from him. Now, the idea is that as a child, when you're born, your toes are the widest part of your entire foot. To any parents out there, go back and look at your baby's foot imprint when you had them in the hospital, and look at how the foot looks. The toes are the widest part of the entire structure. Well, what happens is that around the age of 2, 3, 4, 5, when we start putting shoes on our children, modern shoes, not toddler shoes, but modern shoes that you start getting when you're a young child, are actually very, very narrow. Even the ones that say wide, like, double E or anything like that with the width, they are very, very narrow. And this is because a majority of shoes are constructed from a fashion forward viewpoint. It's because we don't believe that people will actually buy shoes that are shaped like feet. And this isn't something brand new. You can even look back to research that, chronicles shoe construction from, the 17th century, in that a lot of people who were of nobility and whatnot, they had very narrow toed shoes because that showed that they were of higher class. So it's nothing brand new. It's just modern day shoes, Nikes, Adidas, Reeboks. They are all extremely, extremely narrow. What that does is actually pinches your toes together and actively, unbeknownst to you, because you don't feel it usually happening, it's deforming your foot. So most people, when you look at their feet when they're 30s, 40s, 50s, they have a small bunion on the inside part of their toe. And that's not hereditary, despite what most people will say, oh, my mom had bunions. Well, it's because your mom also had very narrow-toed shoes. Because here's the reason. When you look, and there's a lot of research on this, if you look at native populations that do not wear modern footwear, they don't have these problems. They don't have bunions. They don't have foot deformities. They don't have hammer toes. They don't have issues with plantar fasciitis, because they actually wear shoes, or even don't wear shoes. They wear shoes that are shaped like feet, the modern moccasin or a sandal, things like that, that allow your foot to function naturally. And if you see someone's foot who hasn't ever worn shoes, I mean, their toes are very, very wide. That's the way your foot was designed. However, when we accommodate your foot to within a very narrow toed box shoe, for a long time, it actually deforms the foot to be very slender. What that does is actually hurts your foot's ability to stabilize. When your toes spread out, it gives stability to the entire structure, sort of like riding a bike that's got training wheels. It's got a wider basis of support. Well, that's the way your foot should be. Now, toe spacers, what do they do? Well, when we think about teeth, that become out of alignment as we get old. What do? We wear braces, we wear like Invisalign. Think about toe spacers like Invisalign for your feet. And actually, they help spread your toes out and get them to change back into the position that we want them in. Now, this actually is possible. It takes a little bit of time. The longer you've been wearing shoes, the longer it takes. But I've had a lot of people start wearing, and I personally recommend the brand Correct Toes. They're a little bit more expensive, but they are well worth it. Um, but they will push your feet out into a better position. And obviously, you have to change your footwear. Can't wear Nikes anymore. You have to buy shoes that actually will accommodate a wider foot. And I, again, make a number of recommendations on, I've got some YouTube videos out there that show the ones that I like, but there's a number of emerging markets every single day. But it is possible within months to years of wearing things like this, your foot will look different. Your foot will actually have the ability to spread out, and it helps from a stability performance standpoint. Your foot will become stronger. Your foot will be able to stabilize better. It will decrease problems in like knee wobble whenever you're squatting, which is why I exclusively squat barefoot now. And for our older populations, it decreases the risk of falling whenever you have stronger feet that have the better ability to balance. So there's a number of different applications for it, and it's something that I think eventually we're going to see a lot more people getting into. And then hopefully we don't need to wear toe spreaders much more often, because then your foot actually is the way a foot is shaped. So we should wear shoes that don't do a lot to the foot. But unfortunately, we see a lot of commercials nowadays from these big brands that are like, oh, this is the most comfortable shoe. This is the most cushioned shoe, the best arch support. Your foot was designed with an amazing arch. And even if it's not very, very high, that's not a bad thing. Most people can have a very, very good functioning foot, even if it's flat. Like a lot of doctors will tell people and scare them into thinking that oh, your foot's extremely flat. Very, very small percentage of people are born with an actual problem foot that need an orthotic.
So we're nearing the end of the hour. If anyone has any remaining questions or comments for Aaron, please type those up, get those in. We have one from Alex on Facebook, and I don't know that you'll be able to speak much to this
Okay.
because it seems like a supplement question, not so much like a PT question, but and I don't even know if I'm going to pronounce this correctly. Fortitropin is a supplement with increasing use in veterinary medicine, seems to decrease sarcopenia and post-op muscle loss when immobilization is needed. It decreases the amount of circulating myostatin. This is now made for human market too. Is this something only those training at high levels would benefit from?
I will say that supplements are definitely out of my expertise, so I won't speak on that. But I will say that there is a lot of positive benefits we can get as far as myostatin and other things like that with immobilization, with blood flow restriction training. So I wrote an article on the lifter's guide to blood flow restriction. That's on my website, squatuniversity.com, that if someone is having an immobilization, particularly post-surgical, there's a lot we can do to maintain muscle size and strength whenever we can't move the joint.
Okay. I am out of questions. Did you have anything that you wanted to add, Megan?
Just that this has been extremely informative. Thank you so much.
You're welcome.
Yeah, this is incredible stuff. I'm so grateful for exercise. I'm grateful to know how to do it correctly. I think, more people need this at the ready and this information available, and truly appreciative that you're throwing it out there into the world. This is what we need.
Thank you.
So Ellen's asking, where do we get the book? Well, hopefully, if you're in New Haven, you'll get it at the library. But I know, Aaron, that it's probably nice to, see some royalties come in from all that hard work. So where else could people find the book?
People can pick up the book all over Amazon.com. I believe Target and Walmart have it, Barnes and Noble. Basically anywhere you can pick up a book, you should be able to get Rebuilding Milo.
Okay. So I think we're gonna cut it a little short. We don't have any more questions for you. Thank you so much for coming today, Aaron.
You're
This
welcome.
was incredible.
You're welcome.
So just a couple really quick housekeeping notes. Today's program was made possible by gifts to the New Haven Free Public Library Foundation. If you enjoyed today's discussion, please consider making a donation at nhfpl.org/donate. To help support our collections, our programs, and our services throughout the year. And please, there's a link to a survey in the chat, and hopefully that will also appear on Facebook in the comments. If you did enjoy this discussion, please take a moment to complete that survey. We read all of the surveys. People hardly ever fill them out, but we read them, and the last one asked for something like this, and we brought it to you. So if there's something you'd like to see or you want more of this, please give us your input. We're always open to that. And if movement is your thing, which I'm assuming it is, after watching this discussion, feel free to join us next month in August in person here for our August Ives in Motion exercise series. It's on our outdoor patio here at 133 Elm. Every Wednesday at 6:30, we'll have Fresh Airflow Yoga, which is brought to us by Yoga in Our City organization. And on Saturday mornings at 11, we're welcoming a group fitness instructor, Joy Elise Hudson, who's going to bring us boot camp, HIIT, and a lot more every Saturday at 11. And details for that are on our website calendar, or you can feel free to email me, rmartirana@nhfpl.org. And again, Aaron, I'm so honored to have had a chance to chat with you. I'm a huge fan,
Thank you.
and you've been very helpful to me getting my knees back in order so I can squat again. It's my favorite exercise. So
I'm
thank
glad
you
to
so
help.
much.
You're very welcome.